Thokozani, Ruperile, Ndawo, Shewe, Kamago. Tonight we are going to be talking about the skin. Yes, the skin, our skin. As we know, the biggest organ that a person has is the skin. So tonight, I am Gogo dermatologist. Yes, tonight I'm going to be your dermatologist. So we'll be talking about everything to do with your skin medically and as well as traditionally ngobungoma. I will mention few things about the skin, how you can treat or how you can take care of your skin. Lapha at Emahlaba Healing Institute, we've got products, natural products that we use for our skins. So thank you so much, South Africa. Thank you so much, Africa. Thank you so much, surrounding countries and continents. Everybody that was communicating with us, asking questions. We are so grateful because when we communicate, you learn every day. So I enjoy people who communicate. I enjoy people who engage. Those questions make me to research further and I gain a lot from that. So thank you so much for subscribing. Thank you so much for liking the videos and sharing so that everybody can gain that one thing. My issue and my reason for doing things, these videos, is so that we can learn, is so that we can heal, is so that we can rectify where mistakes are. So it's so that I can learn also. So big up to everybody who is tuned into this channel. So yes, as I said, tonight I'm gonna be your dermatologist. So lapha ekhaya ke sikhuluma ngesikhumba namhlanje, the skin. Doesn't matter whether the skin for the face or the whole body, but we're gonna be talking about the skin. Sikhuluma ngesikhumba sethu ke namhlanje. I will talk everything medically and sangomakali. As if there is that word. Anyway, that's my vocabulary. Okay, today I'm really in a good mood. The weather is really good. We're having a little bit of showers, not raining yet, but we're having some showers. So it's for now, we are thankful for that. We've been burning, yo guys, but then yeah, the weather is so cool. I love the rains and cool weathers, and well, anyway. So the skin. So what happens about the skin is that normally the diseases that we have, normally it will be shown on the skin. The skin is the one that is going to show that lo muntu lo ugula ini or ingulo yakhe yini. So normally, as I want to translate so that everybody can understand, because I'm not talking to only South Africans here. What I'm saying is that most of the diseases and sicknesses that we have in our bodies will be shown on the skin, most of them. So by me looking at a person, you can tell what lo muntu lo ugula lo, lo muntu lo ugula lo, lo muntu lo unani, lo muntu unani, by just looking at the skin of that patient. So diagnosing a patient based on the skin is also not difficult if you know what the signs and symptoms that you see on the skin. So as we say that many diseases and sicknesses can be exposed or revealed on the skin. So what I find is that in our practices, it's either ebunyangeni or the white collar the white collar institutes. Most of the mistake that we do is that when we try to treat patients who come presenting with skin diseases, we only look at the external and we want to treat the external only. The external, I'm talking about this. Ngoba uzobe ubona ukuthi izilonda zila bese wena nawe uthi mina okay ngiyasazi or ngiyawazi umuthi or amakhambi or I know the ointment, the creams that can treat this rashes or eczema, whatever. So what I'm saying is that most of the mistake that we have, or the mistake that we do normally with other skin condition, is that we only look at the outer layer and then try to treat the outer layer with whatever that we are using, only to find that what you are treating is the exposure of what is happening inside. What you are treating externally is something that the body is trying to tell you that inside there is this and this and this. So some of the diseases, when you treat them from inside, eventually whatever is on the skin disappears. So which means inkinga ilapha phakathi. If you can treat internally and then this disappears, it means inkinga ilapha phakathi. So what do? Deal with the inside. That's it. Most of the skin diseases, what you need to do is to treat from inside, and you're done with the skin. Simple. So you need to know what this kind of rashes, this kind of outbreak on the skin is caused by this disease. Then how do I treat this disease or this sickness? Then you're done with the skin. Most of the problems are not on the skin, on the epidermis. It's inside. So deal with what is inside. Then you'll be done with the skin. It's easy to treat the skin. Easy, very easy and simple, but it becomes so difficult and a daunting task for other people to deal with the skin, because they want to treat the external, what they say. Yebo phela uzogcobisa lokho ogcobisayo for that month, for that week, bese kuyanyamalala. But the following month, the following week, kubuye futhi ngoba you did not kill this thing from inside when you are busy cleaning outside. Only to find out uingulo, ubugulo, disease, virus, whatever is inside. So the first thing that you need to do is deal with the gut. The gut. Clean that gut. The digestive system, is it that whole system? That's what you need to deal with for some cases of the skin. Some cases that has to do with the sickness that is inside, deal with the gut. That's where the absorption is taking place. That's where the absorption is taking place, and everything will flare out to the skin. Ake unathembisa. That's the thing that's gonna kill those bad guys inside there. To be honest with you, that formula works for me. That formula works for me. I've got children who never had skin diseases, who never had skin problems. I have dealt with teenagers, the ones that I dealt with from younger age, the food that they eat, the herbs that they eat, that built their immune system, and when they reached their teenage stage, they never had this issue of skin disease. Even this stage, the pimples that the kids will have, the teenagers will have, and it's called stage, and it's ibiza kanjalo. The kids that who have been around me and eating what I eat and the herbs and They never had that problem. Why? Because we take care of the gut while they're still young and growing up. We take care of the gut. So whatever that enters into the stomach will be revealed also on the outer body. Right? So the food that we eat also contributes in the skin getting irritated, because whatever you eat, the skin will show. So besides the diseases that we have that will show on the skin, the food, the drinks, the water that gets into the stomach and get absorbed will be shown on the skin. The first culprit is sugar. Sugar. That one, if it hates you, it will flare and flare and flare. You see. So deal with the gut when you want to be successful with the skin. Abanye ke, you didn't ingest anything, but ke bakushayile ngesicitho. Isicitho naso bangakushaya ngesicitho sesikhumba, so that everything that bakushaya ngakho kubonakala lapho nesikhumba ungathandeki. So that's another thing that you need to know. Besides the food, because besides the natural diseases that one can have, bangakushaya ngesicitho. People can bewitch you so that your skin becomes so bad. There are many diseases that you can get through being bewitched. Ingulo inengi, ubuguli bukhona obuningi lobu ungabona through ukuthakathwa. The obvious one is isicitho, the one that we know ukuthi umuntu bangakushaya ngesicitho, isikhumba sakho sibe nginyento nje. And then abanye ke babashaye ngesifula, ube nezilonda ezingaphuliyo, uthe bathe isilonda sithi next, bakushaye ngesifula ke lapho. So isifula naso, it will show on the outer skin. And so you must know what you have and why you have it. That's when you know how to treat. So a proper diagnosis equals to proper treatment and better results. Good results, not better results. Good results. So I start with the diagnosis. Get a proper diagnosis. Get a proper treatment. Then you get a proper or clean skin or good skin. Another thing, again, it needs food. Water into your body is like petrol in the car. You need water in your body. Drink water. And mangithi nginathana amanzi, kunalabo abathi mina ngiceda 5 liters every day. Like, really, drink water reasonable. Don't flush out the good nutrients that are needed in your body. Yes, the water you need so that you can flush all the toxins that in your body, so that the blood circulation and right? But don't over drink water, because you will flush also the good nutrients that is needed in your body. Don't drown your body. Right? So rehydrate your body. Ake ufake lo petrol lapha emzimbeni wakho. Amanzi ngipetrol omzimba wakho. You can't drive a car without petrol, right? Or diesel. So same as your body, you need water. You need water so that it can flush out all those toxins. You need water so that the other organs can use it. And there's a lot of uses that is needed by your body. A lot of percentage in your body is water also. So your body depends on water also. So for your skin to be healthy, to be radiant, to expel, it needs water. So make it a habit to drink water. But don't over drink water. Don't drown your body. Drink water kahle. So ake ninathe izimbiza, ake nidle kahle. Nizobona ukuthi indaba leyo ukuba nesikhumba nesikhumba esibi izophela. And don't just gwinya everything, ingadli yonke into nje. Uma udla yonke into nje, then counteract and eat or drink imbiza, dlana imfino, like your veggies, just like, you know what, it's no longer raining. The veggies from the bush, from the emasimini, the ones that doesn't need fertilizers, and those are the veggies and fruits that gonna heal your body. The fruits, our fruits that grows on in the bushes, the ones that you call wild fruits, those are the fruits that are gonna heal your body and your skin. You know, so we need to go back to those, but unfortunately ngoba sathathela umhlaba and we are deforesting the bushes, we are left with those chemicals that in the shops. Those are the things that we are forced to eat, you know, and those ones also, the chemicals that are on those foods are the ones that are bothering our skins much. So some of the chemicals that are in these foods are the ones that are bothering our skins. So as I said, it is always something that you ingest and then it will flare out. So for you to correct that, you need to deal with the gut. For you to correct, you need to deal with the gut. So as you eat these other things that are available and exposed to you, make sure that you also counteract. And so that's it. Just know that you need to be properly diagnosed, get proper medication, and then that's it. Applying only when you see or you know and you are told inkinga ilaphakathi won't solve the issue. Deal with what is inside, then you'll see. You'll be better. Deal with leso sichitho the proper way, then you'll see your skin coming back to normal. Deal with leso bathini imeco, sifula, all those things. So normally your skin will be shouting out to say, you know what, la ngaphakathi ukhona idoda engidlayo. Your skin will be screaming and telling you inside there is something which is not supposed to be in there. Please take it out. So listen to your skin. Your skin is communicating with you every day. Your skin is screaming every day. And so just make your stomach to be uncomfortable one day. Unathi nje izimbiza. And I know that those abathandayo ukuthi mina ngizophalaza, mina ngizopeyita. Yebo phela peyita ngomuthi obulalayo leyo nonsense elaphakathi. Phalaza ngomuthi ozobulala le nonsense le phakathi. Don't just gabba and phalaza with something that is just taking out the dot le oyidlile kuphela, but the things that are inside the bloodstream is not taking it out. So drink phalaza futa with something that is gonna kill these bacteria, these viruses, this fungus that is growing in you. Try to find something that will make those things to be uncomfortable and kill them. Uzobona ke nesikhumba sakho siba right. You see, so Gogo dermatologist ke lo talking to you tonight about your skin, taking care of your skin. Eat well, drink water, nathane lezimbiza. Don't be comfortable with something which is not normal in your body. Try by all means to research. Try by all means to find help. Abanye banishaya ngesicitho, abanye is full, abanye it's just the food that you are eating. Abanye is the chronic diseases that you are having. Abanye is the chronic medications that you are having, which is bothering your skin. So applying only externally, for some it will help, for some it won't help. There are cases where you really need to go deeper. You really need to go and search inside as to what is it that is causing this thing, especially for those cases where you apply whatever, it comes back, apply, comes back, apply, comes back. Then ikhona into wrong apha. Just look inside. Just redirect and look again and check again until yini, which is always coming back. Alright, so kunjalo bogogo nawamkhulu, ngugogo dermatologist. Ngawe shewe.